Good afternoon, Rhode Island. Thank you for tuning in. It's great to be with everybody. Thank you to the press for covering this. It's a big week. It's an important week. I'm going to be on every day this week at 1 o'clock talking about the coronavirus, specifically around schools. It's one of the most important decisions that we will all be making. Will I send my children to school? Can we open the schools safely? How? What's it going to take? Over 100,000 kids are counting on us to deliver them a high-quality education. And so I've decided to spend a little bit of time every day this week sharing with the people of Rhode Island what's going to happen in schools K through 12 here in Rhode Island. I will say yesterday I had the opportunity to be on a conference call with the White House and 49 other governors, and every state is struggling through the same issues. If anything, Rhode Island is leading the way, and others are learning from what we are doing. And of course, I'm learning from what they're doing. But, you know, we're all in it together, not just here in Rhode Island, but as a nation. This is a school year we're never going to forget. And it is my hope that we are going to deliver a high-quality education to every student in the state of Rhode Island. It's going to be harder. We're all going to work harder. The children deserve it. We cannot, they've been out of school for too long already. We owe it to them to get them back in school. And I think we're going to learn many things in the process that'll make us better as we go forward, even after we have a vaccine for the coronavirus. So I'm going to begin every day with a quick snapshot of the data, because we've all been working so hard, everyone out there and my team, to make sure that the cases are as low as possible at the time that we go back to school. And today is another good news story about the data. Yesterday, we performed over 3,500 tests. It's a lot of tests. And the percent positive rate was about 1.5%. We had 53 new cases. That's a great number, 53 new cases. And very sadly, another 2 deaths. Every day we continue to lose people to the virus, which is why absolutely every day, let's stay vigilant. Dr. Alexander Scott is going to talk a little bit more about the data in a couple of minutes, but I wanted to reassure you that Rhode Island is in a very stable place. 1.5% test positive, 53 new cases. That is exactly the kind of news we need as we think about returning our kids to school. I want to say it was 6 months ago today that we reported our first case of coronavirus here in the state of Rhode Island. I don't know about you, but it seems like a lot longer than 6 months ago to me. We've been at this every day for 6 months. And if I think about where we are now compared to where we were then, we've come a long way since then. Yes, the virus is still here, and sadly we lose people every day, but we've adapted. You know, we have adapted the way we do business, the way we live. We've developed systems for testing and contact tracing. Our hospitals are at the ready. So to all of you who've been working hard and struggling through this for the past 6 months, I want to say thank you. And I want to remind you, there is light at the end of the tunnel. There will be a vaccine. I don't know when. Members of the press may ask me, I don't know when. But we've been at this for 6 months, and in some number of months, we will have a vaccine. And so we just have to hang in there a bit longer. Okay, I want to take a minute to recap yesterday's announcements. Today's going to be a very short press conference. Yesterday was long. We threw a lot of information at you. So I would like to take just a minute to recap where we are in Rhode Island with public schools. Every single school district, except Providence and Central Falls, has been given the green light to return on September 14th to full in-person school for all students pre-K through 12. So that is crystal clear. Providence and Central Falls, their cases are a little bit higher, so they're going to start with partial in-person. They can't go full in-person, so they're starting with partial in-person. And Providence and Central Falls, we're going to reassess in about a month to see if they also might be able to go back full in-person for all kids. So every district in Rhode Island except Providence and Central Falls, we expect, it's the state's expectation and Rhode's expectation, that the districts will provide an in-person, in-school, high-quality public education for every student. Now, that doesn't mean every kid has to be back in school on September 14th. We expect there'll be a gradual ramp up between September 14th and October 13th, where they'll gradually over that month get all the kids back in school, so that by October 13th, every child will be in school every day. Now, I want to be clear because there was some confusion yesterday. If you're a parent who is choosing to keep your child home, that's fine. You can continue to do that even after October 13th. That is your choice, and you will be provided with a virtual learning experience. But if you're a parent who is choosing to send your child to school, you want your child to be in school, then you deserve that. Schools will be open starting September 14th, and gradually between September 14th and October 13th, your school will move to a place where every single student will be in school by the 13th of October. And starting September 14th, they'll begin that process. So I hope that that is clear. Okay, today I want to spend the rest of my time with you talking about testing, because that's an incredibly powerful tool in our toolbox as we fight with the coronavirus, get back to normal in our daily lives, and as we get our kids back to school. From the very earliest days of the pandemic, from day one, Rhode Island has led the nation in testing. And that continues to be the case. We've run more tests per capita than any other state in the country. And we are continuing to run substantially more tests than our neighbors. We test about twice as much as Massachusetts per capita and 50% more than Connecticut. So again, that should give you some confidence. What that means is we're finding more cases of coronavirus, which allows us to isolate those folks and do contact tracing, which is such a powerful tool in keeping the prevalence of the cases low. At this point in Rhode Island, we've run just about 530,000 tests. So over 500,000 tests have been run, which is the equivalent, obviously, of more than half of our population. At this point in time, today, September 1st, our average turnaround time for test results is about 2 days. It's a little bit less than 2 days. And we expect it to stay that way. And there's no question that our aggressive and strategic approach to testing has been a key piece of what's enabled us to be so successful in keeping a lid on the virus. And frankly, it's also one of the main reasons that we feel so confident that we're ready to reopen school and welcome the children back into school. To ensure rapid, effective testing for our school communities, we are creating a separate, dedicated testing structure for K through 12 students and staff at public and private schools. Sorry, not just high schools, K through 12. So through this system, which we're setting up, which is above and beyond our existing testing system, we will have the daily capacity to run 4,000, what they call PCR tests, which are the highest quality, most accurate tests, with results being delivered to you within 48 hours. And on top of that, 1,200 rapid tests. And the rapid test, you get the results within minutes or certainly within the day. So I want to be clear. Testing is key. It is a key piece of the puzzle to keeping everybody safe. Right now, Rhode Island tests more than any state in America on a per capita basis. And we have gotten our tests, the turnaround time down to 2 days. So that's best in class. We want to keep it there. That system's going to continue as it is. Separately, we have built a separate system just for K through 12, which has the capacity to run over 5,000 tests a day just for schools. 4,000 of those are the higher quality, longer turnaround time PCR tests, and 1,200 of those are the rapid get your test results within minutes kind of tests, what we used to run with CVS at Twin River. So here's how the system is going to work. If a student or staff member of a school, student, teacher, anyone who works in the school, wakes up one day and feels sick, any of the symptoms, which we've all become very familiar with now, you feel sick in any way, you cannot go to school that day. You cannot go to work. If you work in the school, you cannot send your child to school. You need to stay home and schedule a COVID test for that day. The way you're going to schedule that test is you're going to call a dedicated K through 12 testing hotline. As we get closer to school opening, we'll share that hotline. But it's going to be, this hotline is doing nothing but handling the volume from schools. Good morning, my child feels sick today. I'm not sending them to school. I'd like him or her to be tested today. Now, you should also call the child's primary care doctor, a pediatrician, or if you're an adult, your teacher, you call your own physician, because that's best care, and you can handle that with your physician. But in order to get tested, if you're an employee or at a school, you're an employee at a school or a student, you call the K-12 testing hotline, and they will answer right away, and they will schedule you right away. When you call the hotline, you're going to be scheduled an appointment at one of our special K through 12 swabbing centers. So we are setting up a dozen or more special swabbing sites all over the state just for schools. As of today, we have a dozen sites already identified in Providence, Lincoln, Cranston, Pawtucket, Woonsocket, West Warwick, East Providence, Westerly, North Kingstown, Richmond, Newport, and Smithfield. And we are working to get even a few more sites up and running by September 14th. And we'll add more during the school year if we need to. So what does this mean? We're trying to make this as safe and convenient as possible. No one should have to drive more than 15 minutes to get to a testing site. We're being very conscious to have these testing sites on routes of public transportation. You're going to have a same-day test. You call a hotline to get it scheduled. And as I say, if we need to add more than a dozen, we absolutely will do that. But we're starting with 12 or maybe 14 sites all over the state. When you get to the testing site, they're going to run two types of tests on you. First is the PCR test, which is more accurate and takes a couple of days to get the result, and also a rapid test. So everyone will have two tests run on them. Now, you may recall a few months ago, I set up a testing task force, and they're amazing, and I want to thank them again. Dr. Curtis, Dr. Caliendo, thank you. They have helped us develop this entire protocol, so it is truly the gold standard for testing for coronavirus. The PCR test is a little bit more sensitive, and it'll take up to 2 days to get your result. On the flip side, the rapid tests, similar to what we used at the drive-thru in Twin River, are incredibly valuable because they help us to immediately identify positive cases. Time is our enemy with coronavirus. Speed matters. Speed saves lives. So that's why we're doing two tests. So if you go, get your rapid test, and it's positive, well, then we know immediately you are positive, and then our contact tracing operation can get right to work immediately and start with the isolation and the quarantine, that's required for the folks that have been close in contact with you. When we had the rapid drive-through at Twin River, for instance, it enabled us to identify thousands of positive cases incredibly rapidly, which was a key piece of our success. You get the results in 10, 15 minutes. It's a little bit less sensitive, particularly on people who are asymptomatic. So that's why we're doing the belt and suspenders by doing 2 tests. And we want speed, but we don't want to compromise accuracy. So we think the dual approach gives us the best of both worlds. Now, while you are waiting for your results, even if your rapid test is negative, while you're waiting for the PCR test results, you have to stay at home. And now I know that's a cultural shift and a massive inconvenience, but it is the way it must be. So even if your child or you start to feel better by the afternoon, you say, oh, it was nothing, I was just tired, you need to stay home until we get the results, which will be a minimum of 2 days. If your test is negative, you can return to school after your symptoms have improved, as long as you're fever-free for 24 hours. The doctor will go into that. If your test is positive, then you need to follow the CDC guidelines before going back to school, which means you need to be fever-free for 24 hours with improving symptoms, and it must be 10 days after the symptoms first appeared. Which means when you wake up in the morning and you feel sick, mark down the date of when you felt sick. Go get your test, wait at home until you have your negative result. If you have your negative result, you can go back to school once your symptoms are gone. If it's positive, you have to wait at least the 10 days, and you, in any case, have to be fever-free for a full day. Let's say you're asymptomatic. Let's say you don't feel that bad, but you had a positive test. You still need to isolate for 10 days, for the 10 days after your swab was performed. So you go get your test, it comes back positive, you feel terrific, it doesn't matter. You have to stay home for the 10 full days from when you were swabbed. And if you're a student, you'll be receiving virtual learning during the time that you're home. Tomorrow, I'm going to spend time talking about what happens in terms of contact tracing and case investigation and quarantining if there is a positive case. So that's what we'll talk about tomorrow. Now, we also have to prepare for the reality that kids are going to get sick during the day, or teachers are going to get sick during the day. You wake up, you feel fine, you go into school, halfway through the day you feel sick. This has happened to everyone. Normally, what would happen is you'd feel sick halfway through the day and you'd tough it out and get through the full day. We cannot do that this year. So please talk to your kids and explain to them if they start to get a fever, if they start to get a runny nose or coughing, please, they have to let the teacher know because they're going to have to be sent home. We cannot have anyone with symptoms in schools. So now if you start to feel sick in school, you go immediately to the school's dedicated isolation room. Now I want to point out, every single school will have a dedicated isolation room. It had to be part of their plan to be approved. And when we do the walkthrough of the facility, we're going to make sure there's an adequate dedicated isolation area. They'll wait there in isolation until they're able to be brought home or picked up. Once you get home, the process is the same. Call the hotline, schedule yourself a test, get your swab, you'll get your rapid results that day, and then go home and wait for 48 hours for the PCR result. So hopefully that's clear and everything I just said will be online. We're also going to be prepared to test certain asymptomatic populations through the K through 12 hotline, particularly teachers and students who've been identified as close contacts to a positive case. If you're a close contact of someone we know has COVID, you'll be required to do distance learning, and we're going to need you to get tested. Close contacts will also get tested at one of our dedicated K through 12 swab sites. But as long as they don't have symptoms, they won't get a rapid test. They'll just get the PCR test because we know the rapid tests aren't as effective on the asymptomatic folks. Tomorrow, we're going to spend the whole time talking about what happens if you test positive, how we're going to prevent outbreaks, how we're going to deal with all of the people in the classroom and in the stable pod of the child who has tested positive. So if you have questions about that, which everyone does, I'm going to ask you to hang on till tomorrow and tune in until tomorrow. So this is how we plan to do testing. It is a separate system we are setting up specifically through K through 12, public and private. So if your kid is at a religious school or an independent school, same system. Call the hotline, schedule a swab, have the test, and then act accordingly. So with that, I'm going to turn it over to Dr. Alexander Scott, and then we'll come back for questions.
Thank you, Governor. Good afternoon, everyone. Thanks for being with us again today. I'll start by giving a very brief snapshot of our numbers for the day. We have 53 new COVID-19 cases to report today. There are currently 81 people with COVID-19 hospitalized in Rhode Island. Of these 81 people, 8 are in an intensive care unit, and 5 of those 8 are on a ventilator. As I said yesterday, these hospitalization numbers have been stable over the last 2 weeks. Sadly, we do have 2 additional COVID-19 associated fatalities to report. One person was in their 60s and one person was in their 70s. Our sympathies and prayers are with the families of these Rhode Islanders. The governor gave a great overview of testing. Some keys for you to know is that Rhode Island has a comprehensive statewide approach to testing with a dedicated phone line specifically for K through 12. That is an excellent approach and really contributes to the planning and structure that we know is critical to overcoming COVID-19. It's the similar planning and structure that we've spoken of with childcare, and it's the same approach that we are bringing to K through 12. I want to follow up a little bit more with this information about someone who has symptoms and how we are handling it. Again, applying the planning and structure approach, we have been very thoughtful in helping to differentiate when a child or staff person has symptoms. There are 2 categories. That person may have the types of symptoms that make it more likely to be COVID-19. Those persons we are referring to as being a probable case. Let me talk for a few minutes about what a probable case of COVID-19 means. We consider it based on the types of symptoms that they have and have determined it in alignment with public health guidance overall based on what is most likely to be associated with COVID-19. Someone could be considered a probable case if they have any one of either of these symptoms. A persistent cough, shortness of breath, difficulty breathing, or recent loss of taste or smell, which is something that is unique to COVID-19 as we've been learning over the last several months. Someone only needs one of those symptoms to be considered a probable case. Someone can also be considered a probable case if they have any two of these following symptoms: fever, chills, muscle aches, headache, sore throat, nausea, vomiting, diarrhea, fatigue, congestion, or runny nose. Again, for this second set of symptoms, someone needs to have two of them to be considered a probable case. Evaluating symptoms in this way to define a probable case is an approach that we've taken that's consistent with public health guidelines, and it helps add structure to how we are going to approach the many different compilation of symptoms that can occur, particularly during these winter months. We need to be able to understand who is more likely to be at risk of having COVID-19, and how can we help accelerate our response to them. So if someone has symptoms that fulfills a probable case, either while at home or at school, the way the governor described, they will be asked to engage with the scheduling hotline specifically for K through 12 so that they can get tested, and we can make determinations about how to handle that individual as well as the close contacts to the individual in the classroom. Because of the rapid testing system that we know has been critical, and we know we are probably one of the few states that has one as comprehensively set up as we do, it's going to allow us to respond quickly. One of our focal points is to minimize disruption to teaching and learning in the classroom. So if someone is a probable case and has symptoms, getting the test as quickly as possible and getting the results as quickly as possible allows the Rhode Island Department of Health, in partnership with the Department of Education and the school and school district, to minimize disruption to the classroom, wait to get those results, and then make a determination about how to respond once the results are back. If the results of someone with symptoms returns positive, we're able to ensure that that individual can quickly be isolated and recover safely at home, away from other kids and other students and staff. And we can work with the close contacts of those individuals to help them be quarantined. And the students who need to be home for that can continue their distance learning from that perspective. If someone returns with a negative test result, they still need to not be in the classroom because they have symptoms. Anyone with symptoms should not be in the classroom. They can recover safely at home, do distance learning, and as soon as they are fever-free for at least 24 hours with no medication to reduce their fever during that time, they can then return to the classroom given the evidence of the negative test for someone who has symptoms and fulfills criteria of a probable case. This is just one example of the comprehensive and thoughtful approach that we will be taking. And all of what the governor shared and what I just shared is already publicly available in our K through 12 playbook. It walks through the different scenarios of how we are handling someone who has symptoms that fulfills criteria for a probable case. It's important to know that regardless of what we have written in the K through 12 playbook, the Rhode Island Department of Health stands waiting and ready to engage with the schools and make sure that we are supporting them and walking them through every case. The playbook is there so that you have a sense of the pathway that will be taken and parents can understand what will be taking place, but you can also know the Rhode Island Department of Health will be by your side, helping to ensure that each individual case is handled the way we need it to be, because there can sometimes be nuances that occur. So this is the way to be able to show we have a comprehensive, thoughtful approach that involves planning and structure. We've made it publicly available so you can dig in and learn and have a sense. And no matter what, each time the Rhode Island Department of Health will be guiding every step of the way in partnership with our colleagues at the Department of Education. All of this information has been and will continue to be communicated to schools, but I wanted to take a moment to explain it here so that parents and families understand the tremendous amount of work that's gone into our planning and the structure that's in place as we're approaching reopening schools safely. So with that, I'm going to pass it back to the governor and let us get started with questions.
Question, Director. How far are we from testing being available at each and every school in Rhode Island?
Our focus is for the September 14th timeframe that we will be ready with the test scheduling hotline in place and the test availability. So we will be ready by that September 14th timeframe.
Amongst the municipalities you stated, I'm talking like a brick and mortar school, a school nurse has tests available on site. Is that something that's even remotely attainable? Because we're getting emails already asking people, or people are asking that question.
It's a great question. It's the ideal that we want to strive for. We have this set up in the meanwhile now so that we can be ready to hit the ground running. But we want to continue to work with our school nurses who do a phenomenal job in helping to ensure that we have our vaccination rates, what they are, and taking care of kids in schools. It's a great place and infrastructure to build on to be able to support testing at the individual school as well. So through this school year, we're engaging all school nurses to work with us so that we can support them and figuring out how to build even more capacity at the school level.
Doctor, despite the enormous amount of comprehensive thought and planning that went into this and the very high quality of the science behind it, it seems to me that one of the problems that will follow from this process is that classrooms and students and their parents may engage in a kind of panic, where as soon as a student in a classroom gets involved in this protocol, they have to vacate the classroom, stay home, go for testing, and so on. Parents may react by saying, A, we want to pull our kids out of that classroom to be extra safe, and B, because our kid was in close contact, even if they're asymptomatic in the same classroom, we want them tested too. And do you see that this might cause a certain amount of rolling disruption as one classroom after another encounters this? No matter how few students are actually infected by COVID-19, many more will need to be tested, and many more will be in proximity of those who need to be tested. And it seems to me that just like the virus itself, that kind of constructive panic, for lack of a better term, will spread exponentially.
Well, it gives an opportunity to come up with a better term than that. It's why we're here talking to parents and to families so that there can be a sense of comfort and confidence in understanding how we are approaching it. This is something that everyone's going to be dealing with nationwide, and we are entering flu season and respiratory season coming into the winter. It's something many parents are already familiar with in terms of how to respond if their child develops respiratory illness or viral type symptoms. And we're adding to that with a system to support what can be done in that situation, which wasn't in place before. So the first key that I want to make sure parents hear is please make sure that you and your children get their flu vaccine this year. That's a critical message to relay to everyone. If you can get vaccinated against the flu, that will minimize how much we're wondering, is this flu, is this COVID-19, is this something else? So that's the first point. Everyone needs to get vaccinated against the flu, whether or not you've done it in the past. This is the year to do it, please. Secondly, for parents to understand, we are taking a very thoughtful and structured approach in how to engage. If there is someone within the classroom who has symptoms, we're going to quickly work to get them tested. We've talked about the isolation room that allows the child to, or the student or staff person to be removed from that classroom quickly. We have already done the work regarding stable groups and assigned seatings. So we will, in general, have a pretty clear idea of who has been involved and be able to quickly offer that guidance and support. And then parents can be reassured. But it's a normal process to be concerned. This is something we're all going to be going through together. The best we can do is talk to you about the system and infrastructure that we've built to respond to that.
Well, I do want to thank Mr. Wendelken and your staff for helping me on the article that will appear in tomorrow's Motif magazine about the importance of getting flu shots.
Great.
But what advice do you have, very narrowly tailored, to parents who are concerned in a specific way? I mean, can you sum up in a couple of sentences, what should parents do if their kid is in a classroom with some other kid who might or might not have COVID-19 but has to be tested for it?
Parents can know that we have structures in place to, number one, minimize risk of transmission and everything that I've just described. And then number two, understand that we are going to be in a scenario where people will be exposed, whether or not it's COVID-19 or the flu or some other respiratory illness. All parents who have school-age children are already familiar with that process. This is not going to be significantly different, except that we have additional resources now to support. So we'll continue to go through this together, and parents can know in Rhode Island, you can be confident there's a system and teams of people who are standing ready to walk through this with you, the same way we have done with childcare. So it's helpful to talk to parents who have been experiencing childcare, and there have been ups and downs, but by and large, we have done well and have been held up as a model state for how to do it successfully.
Dr.
Linda,
Thanks. Governor, one of the questions that the NEA raised yesterday was that if parents are assured by your comments to return to school, but the schools haven't prepared for that influx of new kids, their partial returns may be off or not. So what do you have to say for schools that prepared for X number of parents, and now suddenly parents are saying, oh gosh, it is safe. And so now schools are suddenly having perhaps, 30, 40, 70 more kids coming back than they planned for.
Let's get ready for that. Every child deserves an opportunity to get an education in school, with the exception of Providence and Central Falls, where we think it isn't safe. So, that's the job of these school administrators. That's what we have all been doing, preparing for every eventuality. So, they have a plan for full in-person, every kid, fully distant, every student, and options in the middle. So listen, I am not saying this is going to be easy. That will be more work, more effort. Call the Education Operations Center. Get us out there. Let us help you. Let's get ready. But when there's a will, there's a way, and we'll figure it out. To your question, by the way, kids are out and about every day. They're in the grocery store. They're at the playground. They're in summer camp. They're playing sports. So, we've learned I made the note that today was the 6 months anniversary, if you will. We've learned how to live with this. We are living with it. We're living with it. It's not gone. It's here, but we're living with it. And you have to, obviously, every parent has to do what they think is right for their kids. People say to me, what's the right answer? The right answer is what you feel is best for your kid and your family. But what I'm telling you is we think it's safe to go to school, and we're going to do everything we can to reduce the risk of your child getting sick.
Governor, more schools sent out an email this morning to parents that despite your announcement yesterday, they're sticking with it. Are you aware of that?
I just heard about it before walking in here. I think it's terrible. I really do. If you want my opinion,
Yes.
listen, they did that some weeks ago. before we made yesterday's announcement. They didn't even take the time to think about yesterday's announcement and try to make a plan. Immediately and summarily threw in the towel on all those children. I wouldn't be surprised if parents sue them, and I think they have a very good case. I don't know if there'll be any risk of them losing federal money on account of that. I don't know how you can make that decision in good conscience. I don't.
Is there more possibly behind the scenes here? They're the same AFT as Providence.
Yeah,
Does
possibly.
Providence have a contract? Is this part of the problem because Providence, or I'm not saying problem, but it's because Providence doesn't have a contract?
No, I mean, I don't think so. The superintendent in Providence is working his tail off to get as many students as possible into school. Obviously, we've said it can't be fully in person. No, I think this is just the decision of the Warwick School Committee to say, I don't know, we don't want to try.
Could you just, what advice to Warwick parents, what should they do?
Yeah. My heart goes out to Warwick parents. My heart really goes out to the kids. Like, I don't know how to say it any more strongly. Like, a lot of you here are parents. These kids are going to miss out. They've already missed out on 6 months of school. Now they're going to miss out on another year of school. That could have permanent, lifelong consequences for these kids, many of whom they can't afford to go to another school. That is their only option. Their only hope for a good, prosperous life is a high-quality public education, and they deserve that. And we have said it is safe for that to happen. And so if I were a parent, call us. We'll help you figure out your legal options. We will help you think through it because it's not right.
With the isolation rooms, if there's only one per school, what happens if 15 kids present symptoms?
So they're working it through. There'll be more than one per school. Again, this is going to have to be, we'll see how it goes. It depends on how many kids are in a school. Obviously, if it's a big high school with 1,000 students, that's going to be a different situation than if it's a small elementary school. There may be more than one room. We have given advice on, like, relative to the size of the school, how much space they have to have for isolation. And, but those will be all the practical things that we have to work through. Someone asked a question about in-school testing. We, as the doctor said, we had wanted that to happen, but we've been listening to the school nurses who don't want to be overwhelmed, and, you know, who could blame them? So at least now, as we're just opening school, we thought that it was better to not overly burden the school nurses, set up a whole separate system. Over time, as testing technology improves, as the nurses kind of get the hang of it, we see, to your question, how many kids get sick a day, we may get there. But those are the reasons that we said, let's just do it this way.
Thank you. We'll be back tomorrow.
Bye, guys.